My name is Cassia Russell, and I am going to give an informational speech on schizophrenia today. Schizophrenia, I feel, I feel is a misunderstood disease. Schizophrenia is a chronic disabling brain disorder that about 1% of the American people do have. This disorder does not affect men or women any differently. Basically, they both have the same chance of equally getting schizophrenia. People with schizophrenia may hear voices or think that people are out to harm them, which is pretty serious. Some of the causes for schizophrenia: genes may play a role. If you have a mother or father or brother, sister, any type of relation with somebody who has schizophrenia, you're at risk for schizophrenia yourself. Schizophrenia is a chemical imbalance of the brain, and environment may play a role also with schizophrenia. There are different types of symptoms that come along with schizophrenia, and they're pretty serious, and some are absolutely terrible to live with. But I want you to understand that even though schizophrenia is a brain disorder, some people do still live normal lives. Some people may be institutionalized, but that's if it's, a pretty serious case of schizophrenia. Some of the symptoms would be considered positive symptoms, and those symptoms are things such as like hallucinations, delusions, thought disorders, movement disorders. Delusions would include like paranoia. Hallucinations would be seeing things or hearing things that aren't really there, and the hallucinations usually start showing between ages of 16 and 30 years old. There's also negative symptoms, which is antisocialism, not wanting to be around a lot of people, not wanting to speak. Being around a lot of people would make somebody with schizophrenia anxious. Another negative symptom is being unable to perform normal daily tasks, such as holding a job or even going to school, being able to function in your brain normally, having thoughts that are pretty negative. There's also cognitive symptoms, which are problems with your working memory. And like I said before, schizophrenia does affect the brain in different ways. It just depends on how serious the case of schizophrenia is. There are treatments for schizophrenia. Some of those treatments would include like antipsychotic medications, or you could seek out therapy with a psychiatrist or a psychologist. There is no actual cure for schizophrenia, but there are ways to control it. Researchers are trying still to this day, and will continue to try to come up with ways of preventing and curing schizophrenia, but as of now, there is no cure or a way to prevent it. I know somebody who is living with schizophrenia, and she has a job. She does have a lot of anxiety and emotional problems, but also gets high anxiety when she's around a lot of people, and she doesn't like to talk a whole lot, but that doesn't make her any less of a person than any one of us. Basically, with schizophrenia, I feel like the most important thing is to understand it instead of judging the person who has the disease. Understanding how it affects the brain. People with schizophrenia are, like I said before, sometimes institutionalized, and these are the people that have more serious cases of schizophrenia, such as like paranoid schizophrenics. That's a pretty serious thing. when you're seeing things that aren't there, or hearing voices of people that aren't really talking to you, that's hard to live with. So I just want to make sure that, instead of judging this disease or somebody with this disease, that you actually take the time to know how it affects somebody. And I hope that the information that I have provided today helps you to do that. Thank you.